This conference will now be recorded.
We now move on to the next class of anti-estrogenic drugs. The first class that we have already seen is about clomiphene and tamoxifen, which are selective estrogen receptor modulating agents. And clomiphene is also used in the treatment of female infertility. We next move on to what are called as aromatase inhibitors. Okay, and the example of these aromatase inhibitors is anastrozole and letrozole. If you have your chart where we, or the flow chart where we wrote down about the synthesis of um, these estrogenic hormones or progesterone and the mineralocorticoids and glucocorticoids from cholesterol. If you see in that chart, you have a particular enzyme called as aromatase. This aromatase is a cytochrome P450 enzyme complex, and it is responsible in the catalysis of converting androstenedione to estrone and in the conversion of testosterone to estradiol. I repeat, if you check the cycle where you are getting from cholesterol the different types of sex hormones and glucocorticoids and adrenocorticoids, you will see there is an enzyme called as aromatase, which is a cytochrome P450 enzyme complex, and it is responsible for catalyzing the conversion of androstenedione to estrone and testosterone to estradiol. Okay, now what is the issue with breast cancer? The issue with breast cancer on studying the tumors which were isolated in breast cancer, it was found that estrogens are very high in concentration. So they wanted to decrease the concentration of estrogens. For this, they designed this second class, which is called as aromatase inhibitors. These aromatase inhibitors are very specific in their action. They will block the estrogen synthesis by binding with the estrogenic receptors. And because of this, the estrogen levels in the breast cancer tumor will start decreasing. Okay, so these drugs, that is anastrozole as well as letrozole, both are aromatase inhibitors. They will bind in substitution to estrogen, and they both are used in the treatment of breast cancer. They are also used in the treatment of ovarian cancer. So you can see on your screen, you can see the structure of anastrozole, which is used in the treatment of breast and ovarian cancer. Similarly, you have letrozole. Letrozole is also used in decreasing the concentration of estrogen by because letrozole will bind again to the estrogenic receptors. Both these drugs, if you observe the structure, they are non-steroidal compounds. Okay, and I would like to again mention letrozole also promotes ovulation. So, like clomiphene citrate, letrozole also is used in the infertility treatment for females to promote the formation of eggs or formation of more eggs when the infertility treatment is going on for conception. Okay, so these are actually side uses of letrozole and clomiphene, and they have to be done only in guidance with the infertility specialist. The main use of these four drugs, namely anastrozole, letrozole, tamoxifen, and clomiphene citrate, is mainly in breast and ovarian cancer. Okay, so these are all the anti-estrogens that we have seen. Yesterday we saw 2, today we have seen 2 more. Okay, next we move on to what are called as gestogens, and gestogens are also called as progestins, and the name comes from the hormone progesterone. Okay, and it means gestation. Gestation means to allow thriving or living. Okay, so gestogen, that is the gestation period. The gestation period for a human life is 9 months. The baby stays in the womb for 9 months. So this is also endogenous hormone. You can see that the first hormone that is formed from cholesterol is in fact progesterone, and this progesterone is produced in the ovaries, in the testes, and in the adrenal glands. In fact, it is obtained from what is called as pregnenolone. You can see the chart again. The cholesterol is converted to pregnenolone, and pregnenolone is converted to progesterone. So what is the function of this progesterone? Mainly the function of progesterone is, if you remember, we revised the menstrual cycle yesterday. Okay, so I told you that when the ovulation is happening, simultaneously the endometrium is also preparing itself for receiving the embryo in case there is a coitus happening. Okay, so for the development of the endometrium, the thickening of the endometrium, the progesterone hormone is responsible. So it is responsible for the development of secretory endometrium in the uterus. And as the cycle ends, as this menstrual cycle is coming to an end, the release of progesterone declines. That is, the levels of progesterone fall down. And once the levels of progesterone fall down, this endometrial lining will break down and menstruation will begin. Okay. Similarly, it is also responsible to thicken the cervical secretions in order to maintain the embryo. Like for example, if the coitus has happened and the sperm and egg have come together and there has fertilization has happened, then the cervical secretions start thickening. So it is critical in maintaining the pregnancy. It is critical in letting the endometrial lining to thicken so that the zygote which has formed can attach itself to the endometrium and it can flourish on the endometrium. Okay, so throughout the period of pregnancy, this progesterone suppresses menstruation. It will decrease uterine contractions. You are aware that when the menstrual cycle is happening, there are a lot of uterine contractions that are experienced, or what are called as menstrual cramps. So when this is because progesterone levels have fallen down. Okay, but when the pregnancy has happened, the coitus has been successful. At that point of time, the progesterone levels are maintained in the body, and because of this, the pregnancy is maintained and there will be no menstrual cramps or what are called as uterine contractions. Okay, now progesterone is not working alone, it is working with estrogen. So both estrogen hormone and progesterone hormone will be responsible for preparing the body for lactation, which is going to start 9 months later. So the preparation of it will begin in the first month of the gestation or pregnancy itself. In conjugation with estrogen, progesterone will start preparing the female body for lactation purpose. And like I told you, that in the mid-cycle, the progesterone levels increase. So when progesterone levels increase, that at that point of time, the temperature, the body temperature of the woman also increases. This is mainly to develop an incubation temperature, just in case there is fertilization happening. The body is able to receive that zygote or embryo, and it can attach to the endometrium. So such is the importance of the hormone progesterone. Now, like there can be deficiency of estrogen, there also can be deficiency of progesterone. So probably because the pituitary gland or the thyroid gland or your ovaries are not functioning properly, especially in the case when there is pregnancy has been achieved. So in order to avoid uterine contractions, in order to avoid mid cycle bleeding, in order to prevent miscarriage or what is called as abortion, natural abortion. In this case, the progesterone hormone levels have to be maintained constantly. Now, if, like I said, if the body is not able to maintain these levels, then artificially tablets or progesterone hormones need to be supplied to the girl who is pregnant, or in case there is some treatment going on, then in that case progesterone hormones needs to be supplied. So for this, we have three different classes of gestogens available, or three different types of progesterone preparations available. These are progesterone and its derivative, testosterone and 19 nortestosterone derivatives, and other synthetic progestins. These are the three classes of gestogens or progesterones which are available. These are the different examples from the above classes which I mentioned. Progesterone, it's when hydroxyl group is added to it, it becomes hydroxyprogesterone. Then we have medroxyprogesterone. Progesterone, hydroxyprogesterone, and medroxyprogesterone. All three of them belong to the class of progesterone and derivatives. Okay, and norgestrel and norethindrone belong to the class of testosterone and 19 nortestosterone derivatives. So if you see the structure of progesterone, if you would add a 6-methyl group, it would decrease the metabolism of the drug and it would enhance its activity. So addition of a 6-methyl group, this methyl group, 6-methyl group to the structure of progesterone converts progesterone to medroxyprogesterone. And the advantage of using medroxyprogesterone is that its activity has been enhanced at the same time. The metabolism rate, because the actual progesterone, its oral bioavailability is low. The reason the oral bioavailability is low is because it gets metabolized in the liver very quickly. So to avoid the quick metabolism of progesterone, we have added over here methyl group to give medroxyprogesterone. Similarly, progesterone, here in the case of hydroxyprogesterone, you will see that the hydroxyl group or OH group has been introduced at the penta ring, or at the 5-membered ring system, because of which its bioavailability increases, its half-life increases. That is why we have these two derivatives, that is medroxyprogesterone and hydroxyprogesterone. So as I am telling you this, I hope you are noting it down also. We next move on to two more examples which you can see on the screen, and they are norgestrel and norethindrone. These are made available. Norgestrel and norethindrone are basically 19 nortestosterone derivatives. So they are actually obtained from testosterone. So the modification of the testosterone ring system has given us norgestrel as well as norethindrone. So what has been done in the case of these two structures is the addition of a alkyl group at the 17 position, or the addition of different groups, that is alkyl group again at the 19th position. Both these changes, either of them will give you norgestrel and norethindrone. So 19 norprogesterone is similar to progesterone, and it is used as a substitute for progestational activity. Then we have the alkyl testosterone, like what I said, the 17 alpha alkylyl testosterone, and this alkylyl testosterone has greater progestational activity. Its androgenic activity is less, but its progestational activity is more. And this discovery that 17 alpha alkylyl testosterone has better progestational activity gave rise to the class of 19 nortestosterone derivatives. Okay, so this is about the different derivatives of progesterone. You have progesterone, I repeat, you have progesterone, you have got medroxyprogesterone and hydroxyprogesterone. Then it was seen that when 17 alpha alkyl group is added to the androgen, that is to testosterone, its androgenic activity decreases, its progestational activity increases. So that gave rise to the next class, and that is the nortestosterone derivatives, the examples for which are norgestrel and norethindrone. So when you are writing the structure activity relationship for gestogens, these are the 4-5 examples that you need to put, because of which the different classes of gestogens or progesterones were obtained. Now, like I told you, progesterone is not working individually in the body. It is always working in combination with estrogens. So what are the uses of progesterone? It is used in the treatment of endometrial cancer because it is involved in the developing thickness of the endometrium. Okay. Then it is used in primary and secondary amenorrhea and in uterine bleeding when there are menstrual disorders. So if there is a female whose menstrual cycle is irregular, which is a very common phenomenon these days, what is done is she is put on a course of this progesterone derivatives, either progesterone or its derivatives, and from day 6 onwards till day 25, progesterone tablets are given. So that means the mid-cycle rise of progesterone is being controlled. So here she will keep taking the tablet and progesterone levels will keep on rising. Finally, after the day 25, when she stops the tablets, from the day 26 to the day 35 onwards, any one of the days, she can start her menstrual cycle. The idea is to lead the body to peak and have a higher level of progesterone and then slowly bring it down so that the menstrual cycle can be regulated. So this treatment can last anywhere from 1 month to 6 months to regulate the menstrual disorders. It is used in breast carcinoma and also in PMS, that is premenstrual syndrome, where the girl usually or the female usually experiences a lot of emotional ups and downs, physical ups and downs. In case the PMS is very severe, or it is creating any kind of hamper in the normal life, it needs to be treated. So you can use progesterone, or you can use a combination of progesterone and estrogen for controlling premenstrual syndrome. Okay, we next move on to the most important use of estrogen and progesterone that the human have discovered, and that is contraception. Okay, and this is chemical contraception, which means that there is a chemical is being used to come in between and prevent contraception, that means prevent conception. So taking into consideration the population of our country, the population of the world, contraception is very important. It has a very important purpose, and if required, it should be practiced to prevent unintentional unwanted pregnancy, or even in some cases it has been used to do away with a fetus which is not developing properly. Otherwise, it would result into a child who is in abnormal condition, making the life of the parents as well as the child itself very difficult. Okay, so these are combination hormonal treatment, or what is called as combination hormonal contraceptives, which include estrogens and progesterone, and they are used in the process of contraception. So this contraception or chemical contraception can be of different types. Like there can be a combination tablet. This combination tablet can be a monophasic, biphasic, or triphasic. We shall be seeing each one of them individually. Then we can have only the use of progesterone, which is called as minipill. We can have intrauterine devices. I am sure you must have heard about them, where the progesterone is loaded in the device and it is inserted in the vagina through a small procedure. Okay. Then you can, like you have the intrauterine device, you can have the intrauterine ring. So instead of the device, which is in the shape of a V, you have a ring which is inserted in through the vagina through a easy procedure, and it is loaded with progesterone or its different derivatives, and it is going to give you contraceptive action. Also, if all these are not being practiced, in case there is unwanted coitus which has happened, in case of, for example, rape, or there is a chance that there has been a coitus which has happened from a relationship which you are not wanting to take it forward. So in that case, you can have what is called as post-coital contraception. There is a there was a drug which was advertised, which is used for after, which can be used as a post-coital contraception. I forget its name. Some I pill it was. So that is what is post-coital contraception. So after coitus, within 72 hours, you need to take 2 of these pills so that the chances of pregnancy decrease. Okay. Now, mind you, contraception is not a 100% foolproof method to avoid pregnancy. However, 99% of the times it is successful. So quickly I will tell you about all of them one by one. Listen patiently, and if you are able to take down notes simultaneously, then that is also very good. Other than these, the last one what we have are called as abortifacients. Like I told you, if the fetus of the pregnancy is not developing well, there are abnormalities, there are other chances of the fetus growing up to be a child which is going to have mental and physical issues. In that case, abortifacients are used. Okay, so we will first see this combination tablet, and this combination tablet can be monophasic, biphasic, and triphasic. This monophasic combination, which will have a this combination tablet basically will have a combination of estrogen and progesterone. Now in mono, bi, and triphasic, the concentrations will be different. Like for example, monophasic combination has low levels of estrogen, and one of the side effects of this monophasic tablet is that there can be mid-cycle bleeding or spotting, or mid-cycle breakthrough. And to overcome this problem that monophasic combination was causing because of low levels of estrogen, biphasic and triphasic tablets, or biphasic and triphasic contraceptive methods were developed. So usually in a normal menstrual cycle, the progesterone concentration peaks in between the cycle, late in the cycle, and then In this process, the endometrium is thickened. After that, the progesterone levels start decreasing and the endometrium lining breaks down and the bleeding starts. So exactly this concept is kept in mind, and the biphasic and triphasic tablets or biphasic triphasic combination tablets have been designed so that the same variation in hormonal levels can be obtained, and the process of breakthrough, that is the endometrial lining breaking through and the beginning of menstrual bleeding, is assisted or it is helped for. Okay, so this is about combination tablets. The name itself tells you that both the hormones, female hormones, are used. The next is progestin only, which is also called as a mini pill. Now, the reason that this particular progestin only mini pill was designed was that estrogen, when it is used either individually or in combination with progesterone, it has a peculiar side effect of causing thromboembolism. So in order to avoid that side effect, these mini pills which contain only progestins were designed. Usually progesterone or medroxyprogesterone is used in this particular mini pill. Okay, but again there was an issue with this mini pill, and the issue was that the concentration or the amount of progestin that is present in the mini pill may probably not be able to suppress ovulation. Okay, so this was one of the disadvantages of this progestin mini pill. That is why this IUD, that is intrauterine device, and intrauterine ring, IUR, was designed. Okay, now whatever two tablets that we saw, obviously the name suggests that they are taken orally, but sometimes the dose may be not sufficient to suppress ovulation of estrogen and progesterone. Okay, or sometimes the dose may dose may be not sufficient to even reach the ovaries to have a particular type of action. So it was thought that if we could have a device or a way in which you could directly lead progesterone or more amount of progesterone to be secreted in the uterus itself or near the ovaries itself, then what good results we could get. So keeping this in mind, the intrauterine device of progesterone or of levonorgestrel and the intrauterine ring were designed. So usually this is like a depot preparation which is there in the place in the intrauterine ring, and it has a low progestin dose like the mini pill, but because it is inside the reproductive tract or inside the uterus, the progestin is released directly in the reproductive tract, and we can get a desired result even at low doses. So if you are using higher doses of progestin mini pill or higher doses of triphasic biphasic tablets at a much lower dose of the intrauterine ring or device, you could achieve the same contraception. However, this device is not patient friendly. Many a times this device gets rusted in the uterus, and it causes a lot of discomfort to the patient, and it can cause perforations, that is it can make holes in the cervix or in the uterus. Okay, so taking all this into consideration, from device we moved on to ring. So comparatively, ring was supposed to be more user friendly. Ring was supposed to be more flexible because it is made up of a polymer. So the insertion of this ring is usually 2.1 inches in diameter, and it is loaded with ethinyl estradiol, and norgestrel. Okay, these are the two hormones that it is loaded with, and it is inserted into the vagina. Like the intrauterine device, the advantage, two advantages: no, you don't need assistance. In the case of IUD insertion, you need to be admitted for a day in the hospital, at least for a half day. But this intrauterine ring can be inserted by the female on her own. So what is usually done is the ring is inserted in the vagina for 3 weeks and it is removed, and that 1 week is allowed for menstruation. So once menstruation is over, a new ring is inserted. So like IUD, it does not stay in the body for a very long time, because after all, whether it is IUD or ring, it is a foreign body. So there can be antigen antibody reaction to it, or that, or like I said, in case of intrauterine devices, perforations are formed. So all this can be avoided by using this intrauterine ring, which is loaded with norgestrel and ethinyl estradiol. Then we also have, instead of progesterone or progestin, we can have the levonorgestrel, that is a 19 norgestrel derivative. And the advantage of using this levonorgestrel intrauterine system is that it is released very slowly, and if once inserted, it can stay into the mm, body for 5 years. So like the ring, you don't have to keep on removing it and inserting it month after month. Like the intrauterine device, it is not going to cause you any perforations to the uterus or the cervix. So you can use levonorgestrel intrauterine system also. So all these intrauterine device, intrauterine ring, the levonorgestrel intrauterine system, what all of them do, including the biphasic, triphasic tablets and the minipils, what they do is they thicken the secretions that are coming from the uterus. Okay, now when the girl or the female approaches her ovulation period of 12 to 16 days, where the egg is being released, it is technically advantageous to her that the secretions of the vagina are thin, as in they are able to receive the sperm when the coitus happens. Okay, but when you use all these substances, like you are using the intrauterine ring or you are using the minipill, in that case, two things happen. One is the quality of egg that is formed probably may not be very good, because for a long period of time the progesterone levels are very high. But the most important, two most important things that they do is, one, remember I told you about progesterone being required for thickening the uterine lining. Now over here, most of the times along with progesterone, estrogen also will be present. So this will not allow that uterine lining to get thickened. And if this uterine lining is not thick enough, then even if the zygote is formed or if the coitus is successful, the zygote or the embryo will not be able to attach itself to the uterine lining. At the same time, because the mucus secretion or the secretions from the vagina become thick, the sperms are not able to get through to reach the ovum or to reach the egg. So there will be delay, and like you know, this the lifespan of this eggs is very limited. It is there for only 48 hours or 72 hours. That is the maximum time that it is there. So it will thicken and it will not allow the sperms to reach the ovum at all. So even if the coitus happens, it will not be successful because the sperm will not be able to fertilize the drug. Okay, so these are what are combination tablets, minipills, intrauterine devices, intrauterine ring, and instead of progesterone, you can have levonorgestrel substituted in the intrauterine ring. Okay. Next, we move on to what is called as post-coital contraception. So this post-coital contraception has to be taken within 72 hours of unprotected coitus, and another dose has to be followed 12 hours later. So there are two tablets that are present in that IPIL. I think it was a Cipla product, if I am not mistaken. Okay, so this post-coital contraception usually has uh, two tablets. One tablet contains only progestin, and the other contains progestin as well as estrogen. So one has to be taken within 72 hours of unprotected within 72 hours of unprotected coitus, and the other has to be taken 12 hours later. So this is what is about post-coital contraception. Next, we move on to what are called as abortifacients. So these abortifacients, here you can see on your screen there are two examples, dinoprostone and mifepristone. Okay, these are used in combination with each other to get abortion like action. So it is having abortifacient like action. So like these, there are several therapeutically active drugs which are available as abortifacients, and they are usually progesterone antagonists, and prostaglandin like substances. Okay. Now, if you recollect the chapter of inflammation, which you must have studied probably in your previous semesters, you see that prostaglandins generally are produced in the body in a fight to flight situation. Okay, and pregnancy or a pregnant woman is definitely not in a condition of fight to flight, which means she is not ready to strain her body so much that she can face any adverse conditions. Okay, however, in this case, exactly this that has been put to use as an abortifacient. If you see the structure of dinoprostone, it is structurally similar to prostaglandin F2 alpha. Okay, noted down. Dinoprostone's structure is very much similar to prostaglandin F2 alpha. Okay, and when prostaglandin F2 alpha or dinoprostone in this case, when it is injected into the patient, then it is seen that it stimulates the uterus for contraction. Okay, so this is the effect of a prostaglandin. That is why it is always told to a pregnant woman that she should not stress herself, she should not take any kind of tension, because any kind of physical mental stress always releases prostaglandins in our body, because the body feels that we need to prepare for some adverse situation. Okay, so this concept that prostaglandin will stimulate uterine contraction has been put to use by designing this drug dinoprostone. So this dinoprostone will induce or will cause stimulation of the uterus, and the contractions to the uterus will start, because of which the fetus will be expelled out of the body. At the same time, along with dinoprostone, mifepristone is also given. So this mifepristone acts directly by antagonizing the effects of progesterone. So what is the role of progesterone? The role of progesterone is to maintain pregnancy. Okay, but this action can happen only when progestins or progesterone bind to its progestinic receptors. What mifepristone does is mifepristone will go and bind to the progesterone receptors. Now, there are two things that you have to understand. One is, when progesterone binds to its progestonic receptors, at that time the cervix, which is the end or the mouth of the vagina from where the baby actually comes out in a normal situation, is made very hard. It is closed so that the fetus remains safe in the body. Okay, but when instead of progesterone, the second part I am making you understand, this when mifepristone binds to the progesterone receptors, instead of keeping the cervix fixed, closed and hard so that the fetus does not come out, the exact reverse happens. Mifepristone causes the softening of the cervix. Okay, so one part you have dinoprostone, which is causing stimulation of the uterus, and it is expelling the fetus out. And this is further aided by mifepristone, because mifepristone will open the cervix and it will help in the expulsion of the fertilized ovum. The embryo will be expelled out of the body. Okay, so this is all about abortifacients. Two types of drugs are used, dinoprostone and mifepristone. Dinoprostone is structurally similar to prostaglandin F2 alpha. And mifepristone, in short, is a anti-progesterone drug. It has the exact opposite effect after binding to the progesterone receptors. Okay, so this is about dinoprostone and mifepristone, which are used as abortive patients. And the last use of estrogens and progesterones is in hormone replacement therapy. So like they are used together in combination for contraception, they are also used in hormone replacement therapy for women. So estrogen or conjugated estrogen compounds and progestin components like medroxyprogesterone or norethindrone, they all are used in combination to treat a hormone replacement therapy in menopausal women, because when a woman enters menopause, she usually experiences hot flashes. Then there is vaginitis, atrophic vaginitis. There is itching sensation in the vagina. There is a yeast type of infection in the vagina because the vagina has become dry, and she becomes prone to osteoporosis and to heart disease. So in some women, this gets to a very extreme case, and in those cases, you require hormone replacement therapy. Okay, so with this, we have covered estrogens, we have covered progesterones, we have covered the different uses of progesterone alone, and along with its use along with estrogen also. Okay, so now in the next class we shall be moving to androgens and anti-androgens, which are available for the treatment of different types of diseases.